The highly transmissible Omicron subvariant BA.5 now accounts for nearly 2/3 of all of new COVID cases in the country. COVID hospitalizations are now at their highest level since March, with nearly 40,000 people being treated. So I want to bring in ABC News medical contributor and emergency physician Dr. Darien Sutton for more on this. Dr. Sutton, more people are in the hospital not because this strain is more severe, but just because it's so contagious, right? More people are getting infected. So what do we know about these hospitalized patients in terms of their vaccination status? Are they vaccinated, boosted, unvaccinated?
You know, I can speak from my anecdotal experience clinically treating patients in Los Angeles, where unfortunately we're seeing a surge, as well as here in New York and then in Central America and North Dakota, in the central United States and North Dakota, as well as Arkansas. We're seeing rates above 30% case rate increases. And for the most part, a lot of these patients, unfortunately, are vaccinated just because the large percentage of the population is. In my anecdotal experience, less likely for those who are boosted, which is what to be expected, because boosters, although this Omicron variant, the new subvariant BA.5, is proving to be more evasive, there is still protection as our vaccines keep us out of the hospital and protect us from death. But these numbers are becoming harder and harder to track because more people are using home testing, which again is a good sign because that means that people are able to treat their symptoms at home. But yes, as you said, the total number is the issue, which leads to hospitals overcrowding.
Now, the Biden administration is now discussing expanding a second booster shot to all Americans. What's your take on that? What are the pros and cons there?
I think it's going to be a really big, difficult time to try to communicate the benefits of that to a population. And the reason why is because we're hearing that this new variant, the BA.4 and BA.5 variant, are being successful at evading the immune system. But many people are going to say, then should I just wait for the future vaccines, which might be more specific? And I have to say that those are not yet available. So what we have to do now is use what we have to protect us the best. And I think of this kind of like a rainy day. And if when you look at these numbers, you want to think about it as raining heavy outside. And so with that being said, you want to protect yourself. You have your vaccines that protect you from hospitalization and death. You get your booster to add to that protection. You wear your mask and you distance yourself in crowded situations. And overall, that is what your goal is, to decrease your risk as much as possible.
All right, Dr. Darien Sutton, always great to have you. Thank you.
Yeah, of course.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.